Um, Good morning, everyone. I'm Pramita Shrestha, PhD first year student in the Department of Epidemiology, and I will be discussing with you all about my proposal for the PhD dissertation, and it will be entitled as Universal Health Coverage and Cardiovascular Diseases in Nepal. So before I begin, I would like to make you all note that this is my first draft proposal in the form of presentation. So please anticipate some prematurity, especially in the methods contents. And I'll be narrowing down the universal health coverage in coming days. And I'm hoping the feedback from all of you to reconstruct this proposal. So cardiovascular worldwide is the topmost cause of premature deaths and disease. And basically cardiovascular disease is a group of disorders of the heart and blood vessels. Some of the examples of cardiovascular disease are stroke, ischemic heart diseases, rheumatic heart diseases, etc. And if we are able to prevent the behavioral risk factors of cardiovascular diseases, such as unhealthy diet, physical inactivity, tobacco use, and harmful use of alcohol, we will be able to prevent all those premature deaths. So globally, ischemic heart disease and stroke, which are the topmost cardiovascular diseases, are the leading causes of deaths in 2017, and it has been estimated as it has been estimated to remain as leading cause in upcoming years too. So CVD varies regionally throughout the world, and it is common. The CVD deaths are common in low-income countries, followed by middle-income and high-income countries. So Nepal, being one of the lower and middle-income countries, shows that cardiovascular disease is still the topmost cause of Delhi in Nepal. So the health system in Nepal is structured in such a way that it is still not ready to address all the escalating burden of cardiovascular diseases and the out-of-pocket expenditure, which is enhancing the socioeconomic inequalities, which are due to limited government health budgets and low coverage and less priority on health insurance. So universal health coverage basically is all about access to the quality healthcare, which assures that people do not suffer financial hardship and provides essential health services to everyone. And it mainly addresses three major components, such as population being covered in the health services, the proportion of expenditures and the proportion of services included, and Sustainable Development Goal has included universal health coverage in its target as 3.8. So health insurance is a major component of universal health coverage, and it has a critical role in achieving all the universal health coverage aims. And almost 2 billion people are facing catastrophic and impoverishment in the health sector, and health insurance will contribute to provide affordable health insurance to all, and ensures equity access to healthcare services and provides financial protection to individuals and communities. And this ensures that health insurance is a major component to achieve universal health coverage. So World Health Organization has been promoting social health insurance in lower and middle income countries since 2005 to prevent the catastrophic and impoverishment situation in health sector. And in Nepal health sector strategy 2015-20 has been encouraging to achieve, to head towards universal health coverage. And Nepal has almost achieved 53% of universal health coverage target so far. And Nepal also introduced the National Health Insurance Policy since 2014, and it for a few years it implemented health insurance as a pilot project in few of its districts, and by now almost all the districts has executed the National Health Insurance Program in Nepal. And this National Health Insurance has been crucial to ensure the financial protection and access to healthcare services in Nepal. So CBD and its services has been a major source of financial risk in lower and middle income countries, and only 12% of lower and middle income countries listed cardiovascular disease as a high priority of universal health coverage. And such expensive cardiovascular disease services has produced remarkable negative economic consequences, resulting in financial barriers, which is distracting the decision making, which has influenced the decision to engage in care and adhere to medication for cardiovascular disease. So, health insurance program in cardiovascular diseases, which is focused in cardiovascular diseases, helps to improve access to primary health care, primary health and quality care of cardiovascular services, and it helps in health insurance helps in timely diagnosis and treatment, which helps to manage risk conditions such as hypertension and diabetes. And health insurance also ensures to reduce the incidence, severity, and cardiovascular diseases. And health insurance also finances cardiovascular disease care directly and assures financial protection. So this is how I was feeling while I was drafting my aims. Situation right now. I'm hopeful to make it better. So I have my 3 aims in my study. I will have my 3 aims in my study. The first aim will be to assess the association of health insurance with the CVD's risk score. And the second aim will be to compare the impact of COVID-19 pandemic on the prevalence of cardiovascular diseases among the insured and uninsured group. And third aim will be to assess the facilitator and barriers of the health insurance program on the prevention and management of cardiovascular diseases. So the study will be cross-sectional study, and it will be conducted in Dhulikhel municipality of Nepal and will include adults above 18 years. And the data collection will be mixed method in which M1 and M2 will be conducted adopting quantitative method. And for that one, I will be using the secondary data, which will be adopted from Dhulikhel Health Study, Dhulikhel Healthy City Project, and health hospital insurance records. And if required, I will be exploring few other records too. And M3 will be qualitative, which will be complementing the information for M1 and M2. And this will be conducted by I will be doing focus group discussion and in-depth interviews for this qualitative method. And ethical approval will be obtained from respective institutional review committees. So for M1, my outcome variable will be cardiovascular risk score, which will be expressed as continuous variable, but I will be exploring more on this, so I might end up making it dichotomized depending on how it has been used in other literatures. And M2 will be, the outcome variable for M2 will be prevalence of cardiovascular diseases, which will be dichotomized as yes and no. And M3 will be facilitators and barriers, so in which I'll be having more qualitative information. And the exposure variable for my study will be participation in National Health Insurance Program. And I will be more focused on Dhulikhel municipality. And other variables which will which might be my confounders for the study. So those will be socio-demographic variables. So I might add a few more covariates. And for the data analysis, we'll be using R for the quantitative methods and TDOS for the qualitative aim. And for the quantitative analysis, I will be presenting some descriptive information of the distribution of participants. I will be doing linear regression for aim1, and logistic regression for aim2. So this study will be conducted under several limitations. The first one will be the cross-sectional nature, which will not let me to infer to causal relationship, and because I will be having secondary data, so I will not be flexible to address all the relevant indicators. So, and I am anticipating the incompleteness in the data, so which may introduce bias in my study too. So after conducting this study, I am expecting that I will be able to inform the health insurance programs and policies to emphasize on preventing and managing cardiovascular diseases. And I am expecting to generate evidence on the impact of health insurance coverage and reducing disparities in cardiovascular diseases. And I'm also expecting that this might end up informing the policies to mitigate adverse effect of the health emergencies on cardiovascular disease, cardiovascular health and services. So these are my tentative schedule, and these are my tentative schedules of my activities.
Let me just
These are some of my references that I used to prepare this contents. And I would like to acknowledge every one of you, which includes my mentors, all my ILTP tutors and colleagues, and the teams, and the Department of Epidemiology, where I'd like to acknowledge the faculties, mentors, and my fellows. And I also would like to address the collaborators for this project, the University of Washington, Blue Hill Hospital, and most importantly, the participants of the study. And I will not be able to be here without the support of my beloved family and friends. Thank you so much.
Thank you so much. Do we have any questions, either from us here in the room or anybody online?
We have a question.
Really?
Yeah, so, okay, thank you.